Hi everyone, thanks for coming. We're gonna wait for a couple more people to hop online. I am Sydney, one of the senior dosage specialists on the dosage support member education team. Again, just gonna wait a little bit for some more people to hop on and then we'll get started. Again, welcome everybody, welcome. We're so excited to have you here. So this is officially our second installment of our weekly EQ and Use series. Last week, Maya did a really great one talking about CBD and sleep. Today, we're going to be talking a little bit about CBD and mental health, in particular, mostly about stress and mood here. So again, I'm Sydney, one of the senior dosage specialists on the team. Welcome to those of you that have come in, and let's jump right into it. So thank you first to everybody who submitted some questions for us yesterday and the weeks prior. We're definitely going to be answering a number of those today, but specifically, we did get a lot of questions about using CBD to treat anxiety. And the first thing we really have to keep in mind when we're talking about CBD and mental health is that we are not using CBD to treat underlying medical conditions, but rather we are using it to address the symptoms of these conditions by amplifying your body's own natural balancing and healing properties. So that's why we talk about these things in terms of stress and mood. Another thing that I really just want everyone to keep in mind as we're talking about all of this is that CBD is not necessarily an overnight fix. It takes time for our bodies to adjust to CBD being around, and even longer to see those maximized benefits. On average, our members are looking at about 3 months to get those best results. But along the way, we can really be on the lookout for those small, steady, incremental improvements. So for those of you who haven't started yet or are just starting, a couple questions that you can always ask yourself as you're getting into a routine are, was I less reactive in a stressful situation? Did you feel kind of that underlying buzz of stress reduce a little bit? Did a partner, a family member, friend, colleague, coworker, did any of them notice that you're feeling a little bit less stress or acting a little bit less stress, handling stressful situations a little bit better? It often is a lot easier for those around us to notice a change in our behavior and our mood before we do. So if you have the people in your life that you can talk to about this, they are a really awesome way to get everybody involved and take more of a critical view on how that CBD is really working for you. So another thing to keep in mind as we're talking about CBD for things like mood and stress, we are going to be talking about daytime CBD doses. And as Maya mentioned last week, CBD is working in part with your circadian rhythm. Generally, CBD is working in a system called the endocannabinoid system, and that system is responsible for maintaining balance throughout your body, including working with your circadian rhythm. So CBD does not make you inherently sleepy. During the day, a lot of our members are using a little bit of a smaller dose to help promote things like a sense of calm and focus. Whereas at night, people do take CBD sometimes for that sedative effect to help them relax. So now that we've gone over a couple of those little small tips and tricks, things to keep in mind, let's jump into actually using CBD to manage some of this stress and mood. So for all of you beginners out there, I see a couple of you writing in that you haven't started yet. You're a little bit nervous. When we're looking to address stress and mood with CBD, I would recommend starting with one of our signature boxes. In particular, I think our balance box or our calm box is going to be a really great place to start. Both of these boxes have both the daily soft gels and the daily drops, which, as the name suggests, should be used on a daily consistent basis. Taking your CBD every day is going to be the best way to get those maximized effects, those maximized benefits. And then on top of the daily soft gels and the daily drops, the calm box is also going to have the rapid calming melts. Now, those are going to be used more in those peak moments of stress when you're very overwhelmed, something that's not a day-to-day situation. Whereas with both the balance box and the calm box, again, the daily soft gels and the daily drops are going to be your base routine. We're going to use them every day. So just a brief overview on each of them. Soft gels are going to be that more extended release product that we offer. They are swallowed like a vitamin. We ask that you take them with food so that you can absorb as much of that CBD as possible. They take around 1 to 3 hours to kick in. and they last in your system for an average of 6 to 8 hours. The drops, on the other hand, are going to kick in a bit harder and faster than those soft gels, usually about 15 to 30 minutes after you take them, but they do only have effects lasting an average of 4 to 6 hours. The rapid calming melts are quite similar to the drops in that they have a faster onset time, normally around 5 to 10 minutes. But on the flip side with those, they do only have effects lasting an average of 3 to 6 hours, which again can make them really great to use as needed during those spikes of stress. Another thing I want you to keep in mind as we're talking about this, everybody's body chemistry is different. So these different recommendations we give, some of them may work for you, other recommendations might not work as well for you, but that is exactly why we do have the dosage support team. We have the member education team. We are here to help you navigate the world of CBD dosing based on both your experience and our understanding of how the products work. So you will absolutely never be left alone throughout this entire process. Whenever you need us, we are here. So a couple people did write in asking about tolerance with CBD. Can I get addicted to it? Can I build a tolerance to it? And the World Health Organization did actually put out a safety profile on CBD saying that you can't build a tolerance to CBD. It is non-habit forming, which means you can't get addicted to it, and you also cannot overdose on it. So for those of you who have questions right now about the safety of CBD, you're nervous about starting, it is a very safe supplement to take. But other questions come up, why sometimes do I need to increase my dose? Why sometimes do I need to decrease my dose? And the answer is CBD is, again, helping your body's natural balancing and healing properties. So part of balance is going to be understanding how that CBD is working in your body at that time and adjusting your dose accordingly. So today we're going to talk a little bit about how we can increase your dose when your stressors increase. Believe it or not, stress is one of those big factors that determines what your dose is going to be. So understanding how you can use CBD to help out in those extra stressful situations can be really helpful. So couple different challenges that our members are facing right now. We are all going through this big transition period again, the second big transition in 2 years. We went from normal life to a pandemic, and now we're heading the opposite way. Vaccinations are rolling out. People are returning to work. Kids are returning to school. So if you're somebody that just has maybe an underlying baseline of stress throughout the entire day, maybe you could start off your day with a soft gel, take it again with food, pair it with breakfast, a mid-morning snack, just to get that background subtle support as the day goes on. If you're somebody that not only has that underlying baseline of stress, but has some, spikes of stress that come up on a day-to-day basis, that's a good opportunity to really lean into using your drops as needed. Taking maybe an extra, if you're a regular strength gal or guy, you can use, maybe an extra half dropper of your drops, either right before or right after a stressful situation. Either right before or during, maybe I think we want to use our CBD before or during. We don't want to use it after, but again, can use those drops. Those are also really great opportunities to use the rapid calming melts if you have them. If something is out of the ordinary, your stress spikes to a level that's significantly higher than normal, that's a great opportunity to reach for one of those rapid calming melts, put it under your tongue, let it sit there about 5 minutes, don't crush it, chew it, swallow it, and get those really fast acting results. So a couple example situations. We had somebody write in saying, what do I do if I'm the mother of the groom? I'm a little bit nervous for the wedding. If that's you, the first thing would be establish a daily baseline routine leading up to the event. We want to make sure that baseline routine is in place. And then you could use something like the drops or the rapid calming melts to help supplement that support on the days when you need it the most, right before, you walk down the aisle, go and do all of those fun things with your family and friends. A lot of other people are dealing with, trying to figure out how to transition back into the office. If you're going into the office, maybe some days that's a little bit more stressful than usual. You can grab some drops. If you have kids that are back in school and you're trying to navigate getting them from school, after school activities, through dinner, bath time, bedtime, Maybe you put a soft gel after lunch or with a mid-afternoon snack to give you support through that period. Or again, supplement with some daily drops or a rapid calming melt when you need it. And then there's still those of us who are working from home. If that's you, you might have the issue of having a difficult time separating yourself from work, pulling yourself away, relaxing at the end of the night. Again, that would be a really great opportunity to increase your dose a little bit, give yourself that extra support when you need it. So, kind of headed into more questions in general here. We do get a lot of medication questions fielded to our team, and specifically a lot of medication questions surrounding different mental health medications. So unfortunately, right now, we aren't going to be able to talk about those specific medication interactions in this platform. We do always recommend reaching out to your doctor before starting a CBD routine as you get started, just to discuss with them the best way to integrate a CBD routine into your long-term care plan. The dosage support team is not composed of physicians. We are cannabis educators, so we are here to help educate you on how CBD works in the body. Your doctor will be a really great resource for discussing how CBD can interact with your specific medications. And then if you are looking for further education on those potential interactions, we do have a pharmacy team available for all of our members to meet with following their dosage appointment. Another number of questions came in about the THC content in our products. Here at Equilibria, we do have a line of full spectrum CBD products, which means all of our products do contain trace amounts of THC. However, all of our products do contain significantly less than the federal legal limit of 0.3% THC. So they are federally legal, and the level of THC in our products is nowhere near high enough to elicit those psychotropic effects, or in other words, it cannot get you high. However, some of these questions did skew toward, drug testing. That is a really big gray area. We don't know how your individual body chemistry is going to react to our products. If you are nervous, we recommend grabbing an at-home over-the-counter drug test. Or if you're working with your employer, you have a good relationship, you can always ask for a blood test rather than a urine test, as that does tend to be a bit more accurate. But the general answer to that is it is a very big gray area. Everybody's body chemistry is different. While it is possible to test positive on a drug test, it is very, very rare, especially with the low doses that our members are typically taking. So I am going to be scrolling through your questions really quickly. Give me 1 second. So I see somebody, C3Malie Play said she's no longer feeling as tense after about 2 weeks, which is really, really awesome to hear. Again, that's the type of small, subtle, incremental improvement that we're looking for. It's not going to be something that happens overnight, but looking out for just being a little bit less tense, reacting a bit better in a stressful situation is exactly the type of thing we're looking for right now. Let's see. So again, somebody wrote in saying that they have paralyzing anxiety. So we're going to talk about that in terms of spikes of stress. But if you do have those stress spikes, as we spoke about earlier, it's going to be really important to understand how your body's responding to each of these doses of CBD, working with a dosage specialist if you have the chance, and utilizing that CBD in those higher moments of stress, reaching for those drops or a rapid calming melt. If you are anticipating that stress spike coming on, well in advance, or in the moment can work as well for many people. So somebody here is asking if you got something like the Balance Box or the Calm Box, can you use both the soft gels and the drops at the same time in the same day? The answer is yes. We have lots of members who are using the soft gels and the daily drops on a daily consistent basis. We have some members who prefer to use one versus the other. We also have some members who are integrating those rapid calming melts in as well, as they are new. Not everybody's had a chance to try them yet. So if you haven't and you are somebody that deals with pretty high spikes of stress, I would recommend giving them a try. And yes, I do see somebody ask about shipping internationally. At this time, we are only able to ship within the US. Satina_H, great question about driving. The answer is yes. When you are taking the right dose of CBD during the day, it should not make you super tired. In fact, it should be almost the opposite, a little bit energizing, helping to promote calm and focus. So yes, you can be driving after taking CBD. It shouldn't really be affecting your ability to go about your day-to-day life. If you do take a dose during the day and get a bit tired, no need to worry. Just drink lots of water and reach out to the dosage support team. We will probably tell you that we want to decrease the dose for a little bit, and you can continue working with us through that whole process. Somebody's asking about some both stress and sleep issues. The answer is yes. Because CBD is working in such a high order system in the body, the endocannabinoid system, it absolutely can help in many different areas. Sleep and stress being two of the biggest areas our members see those or what our members are looking to address with a CBD routine. So if you ever want to email into dosage@myeq.com, we can just send us your health goals and we'll send you some recommended starting routines for those. But again, they're just starting routines. Everyone's body chemistry is different. And what's really great about working with Equilibria CBD is that you do have us on the member education team to help you navigate the world of dosing. And then the last question I'm going to take, because we are almost out of time, what is the difference between the melts and the drops? So the biggest difference is kind of the use case here. The daily drops are meant to be used on a daily, consistent basis as part of your routine, whereas the rapid calming melts oftentimes do hit a little bit harder. They are meant to be reserved for peak moments of stress, not something that's occurring all the time, but say you have a weekly presentation to all your bosses and that really, spikes that stress level pretty high. That would be a really great time to use those rapid calming melts. Or if you have a lot of kiddos running around the house and at the same time everyone decides to have a meltdown and you just need a little extra support, that would be a really great time to use those rapid calming melts as well. If you have any particular cases that you're wondering whether the drops or the rapid calming melts would be a better option for you, feel free to DM us on Instagram, write into dosage@myeq.com, or you can write it into the question box that will be available next week for the next installment of EQ and You on Wednesday. So thank you again, everybody, for coming. It was so nice getting to talk with all of you. Please, again, feel free to DM, email, comment on our Instagram photos, and we will always do our best to get back to you as soon as possible. Have a wonderful rest of your day, everyone.